I have a 30-year-old African American male who presents to the clinic with a new diagnosis of depression and is seeking treatment. The purpose of this education is to discuss medication treatment options for your depression. But first, I would like to ask you a few questions before we get started. Is that okay with you? Okay, thank you. So sometimes when people feel down or depressed, they might think about dying. Do you ever think of hurting yourself or anyone else? Okay. Now, if you were to have these thoughts, do you have a plan in place? Okay. Just want to let you know that in the future, if you do begin to have these thoughts and these feelings, that you do have help available to you, and we can discuss that further after this session. So the antidepressant I would recommend is fluoxetine, 20 milligrams a day. This is a selective serotonin reuptake inhibitor and is considered a first-line treatment for depression. It is generally well tolerated and is relatively safe. It does have some side effects along with other antidepressants, but they do resolve over time. So the most common side effects of this one is nausea, headache, nervousness, insomnia, anxiety. You may experience some sexual dysfunction or weight gain, but like I said earlier, most of these resolve over time. The full effect may take up to 4 weeks or longer, and the treatment should be sustained for 6 to 18 months for the first episode of depression, which is today that you're being treated. Do not stop taking it abruptly because you may experience excuse me, a withdrawal syndrome with symptoms that include dizziness, headache, nausea, tremors, and or anxiety. You also may experience serotonin syndrome, which usually begins 2 to 72 hours after treatment onset, and signs and symptoms include altered mental status, involuntary muscle contractions, excessive sweating, tremors, and fever. This is a medical emergency. And I would also recommend that you have your family to let your family know that you're taking the medication so they can monitor the signs and symptoms as well while taking this medication. If you do develop these symptoms, please call 911 and go to the ER. This usually resolves after discontinuing the medication. Avoid taking herbal medications such as St. John's wort, Panax ginseng, and nutmeg. These may also cause serotonin syndrome as well. Avoid drinking alcohol, and I'd like to follow up with you in 2 weeks to see how well you're doing with the initial dose prescribed. If you are interested, there are other options that you may benefit from along with taking the medication. Would you be interested? Okay, great. You can follow up with me in 2 weeks and we can discuss this further on your next visit. All right, thank you.